My heartfelt gratitude and a sincere appreciation to Professor Iman Muhammad Shorab, Head of Psychiatry Department at Faculty of Armed Forces College of Medicine, for her meticulous supervision, insightful guidance, valuable instruction, humble understanding, and generous assistance. Assistant Professor Zainab Muhammad Al-Akkar for her dedicated effort, invaluable knowledge, precious time, and motivational encouragement. Brigadier General Dr. Ihab Hassan Al-Baz, Lecturer of Psychiatry at the Military Medical Academy, for her constant support, helpful advice, and active involvement. I would also like to express my gratitude to Professor Marwa Abdelmegid Hamid, Professor of Psychiatry at Faculty of Medicine, Ain Shams University, for her presence today and for graciously agreeing to discuss my thesis. And I am also deeply grateful to Major General Dr. Muhammad Diab for his exceptional welcome. Lastly, I extend my sincere thanks to all patients and participants in my study project for their willingness to share their personal experiences and for their invaluable time and contribution. This work wouldn't have been possible without their involvement and support. Dedication, I am dedicating this thesis to my family that has always been along my side throughout this project time plan. I would like to highly appreciate their insistent support and extraordinary belief. Surely, I can thank each one with the deserved amount because it will take a lifetime, but I just want you all to know that you count so much. Introduction. Serious mental illnesses is defined as mental or behavioral disorder that result in significant functional impairment and limit an individual's ability to perform one or more major life activities. These disorders include schizophrenia, major depressive disorder, and bipolar affective disorder. People who suffer from severe mental illnesses may have a life expectancy that is 30 years lower than the average person. Multiple studies have linked the high rate of early death in the psychiatric community to the prevalence of medical comorbidities. Compared to the general population, those with severe mental illnesses like bipolar disorder and schizophrenia tend to have worse physical health. They are more likely to suffer from risk factors for cardiovascular disease, diabetes mellitus, metabolic syndrome, unhealthy eating habits, lack of physical activity, and smoking. Another factor that leads to poor metabolic state is the use of pharmacological treatment for mental disorders such as mood stabilizers and second-generation antipsychotics. A large-scale meta-analysis found that cardiovascular is commonly experienced by persons with mental problems, with 9.9%. Among those with several mental disorders, the incidence of cardiovascular disease military complex. Study duration, January 2024 till December 2024. Study population, 75 patients in each group. Inclusion criteria, both male and females, age from 18 years to 60 years old, bipolar disorder or schizophrenia, presence of one or more physical comorbidities. Exclusion criteria, patient diagnosed with psychiatric disorder other than bipolar disorder or schizophrenia, pregnancy, age younger than 18 years old or older than 60 years old. Study procedures and tools, informed written consent, laboratory and clinical data collection such as metabolic syndrome assessment, complete blood count, thyroid profile, liver function test, kidney function test, electrolytes, and full clinical examination. Tools, design semi-structured questionnaire, structured clinical interview for DSM-4 Scale 1 Arabic version, Young Mania Rating Scale Arabic version, positive and negative syndrome scale for schizophrenia Arabic version. Results. First, descriptive data. This table shows socio-demographic data for the whole study bipolar and schizophrenia group. Show in bipolar group, male compares 69% of the participants. A higher prevalence is seen among those with higher educational level, 50%. Most participants are single with 57%, and a significant majority are unemployed, 72%. In the schizophrenic group, male account for 72% with the participant, and the majority, 52%, have middle educational level. Most participants are married 57% and the majority are unemployed 78%. Current and the most psychotropic drug among bipolar group. The most common psychotropic drug currently used is sodium valproate with dose 1,500 mg per day with 61%, followed by olanzapine with dose 10 mg twice per day with 22%. Other medications such as lamotrigine and deoxycarbazepine are used in smaller proportions. Sodium valproate 1,000 mg per day remains the most frequently used overall. Regarding schizophrenic group, this comparative chart shows the most commonly used psychotropic drug is olanzapine 10 mg twice per day with 52% in current use and 44% as the most prescribed. Risperidone 3 mg twice per day follows in current use with 25%, while haloperidol retard 50 mg is the second most psychotropic prescribed drug. Comparative data. Comparison between bipolar and the schizophrenia group regarding social demographic characteristics. It was found the bipolar group differs significantly in age and the educational level with p-value 0.006. Additionally, marital status also showed significant difference with p-value 0.04 observed in single participant. Regarding clinical characteristics, showed significant difference in compliance with psychotropic medication with p-value 0.034. Regarding the pharmacotherapy profile, significant difference were found in first generation and second generation and long-acting antipsychotic with p-value less than 0.001. Additionally, BSD was significant with p-value 0.004. Medical comorbidities between bipolar and schizophrenic group showing that prevalence of sexual disorder is statistically significant. The schizophrenic group and the schizophrenic group with p-value 0.021. And regarding the medical comorbidity between treatment with antipsychotic among bipolar metabolic syndrome significantly higher in those receiving combined therapy with p-value 0.046. Relation between medical comorbidities and second generation antipsychotic among bipolar group metabolic syndrome is significantly more common in patients with receiving second generation antipsychotic with p-value 0.046. And the relation between medical comorbidity and long-acting antipsychotic among bipolar group, these patients have significantly higher prevalence of medical comorbidity with p-value 0.002. Diabetes mellitus and the metabolic syndrome are both significantly with p-value 0.001. The relationship between medical comorbidities and PSD among bipolar group show that the previously discovered medical problems were significant among BST users with p-value 0.005. Additionally, compliance with medical treatment was significant with p-value of 0.15, as well as follow-up pattern insignificant with p-value 0.016. The relationship between medical comorbidities across gender among schizophrenic patients highlight that obesity in males is significant with p-value 0.023, sexual disorder also significant in males with p-value 0.004. Additionally, metabolic syndrome was significant in female with p-value 0.001. The relationship between medical problems and first generation antipsychotic among schizophrenic group showing that overweight is significantly more common among first generation antipsychotic users with p-value 0.028, metabolic syndrome also significant with p-value 0.012. Relationship between medical problems and comorbidity and long-acting antipsychotic among schizophrenic group show that medical problems and the discovery of medical problems were significant with p-value less than 0.001. Additionally, metabolic syndrome was significant with p-value 0.021. The relationship between medical problems and comorbidity (BST) among the schizophrenic group show that the discovery of medical problems relieved a significant difference with p-value 0.01 being more commonly among those previously discovered medical conditions. Correlative data. The correlation matrix between age of onset, number of episodes, duration of illness, number of hospitalization, and young mania rating scale, and body mass index, and waist size among bipolar patients show significant increase in body mass index and waist size with p-value less than 0.001. Additionally, body mass index and waist size among schizophrenic patients was found significant with p-value less than 0.001. Binary logistics regression analysis to predict the occurrence of medical problems among the bipolar group showed that age and the body mass index were significant predictors in both univariate and multivariate analysis with p-value less than 0.01 and 0.003 respectively. And among schizophrenic patients showed that age and the body mass index were significant predictors in both univariate and multivariate analysis with p-value less than 0.001 and 0.005 respectively. Conclusion: medical comorbidities are common among people with severe mental illnesses as bipolar disorder or schizophrenia and metabolic diseases, as diabetes mellitus, hypertension, highlighting the need for a more collaborative relationship between general medical providers and psychiatrists. Age and the body mass index show positive correlation of occurrence medical problem in bipolar and schizophrenia, and use of long-acting antipsychotic shows strong correlation to occurrence of medical problems. Schizophrenia patients are more likely to fall into the following socio-demographic categories: living with parents, being unemployed, and being single. It's therefore crucial to put strategy into motion that aims to encourage these people's independence or social integration. Both age and the body mass index are key factors in predicting medical problems, with age being the least influential. Long-acting antipsychotic have very strong impact but lose their predictive power when other factors are considered. Therefore, focusing on age and the body mass index could be important for managing medical issues. Recommendations: clinical recommendation: a comprehensive assessment that include evaluating both mental and physical health alongside medical comorbidity is crucial for improving outcomes in patients with bipolar disorder and schizophrenia. Regular screening for medical comorbidity in individuals with bipolar disorder and schizophrenia is essential for reducing disease incidence and improving patient outcomes. Research recommendations: longitudinal investigation are essential to track the progression of medical comorbidities in these patients, provide valuable insights into their long-term health outcomes and the potential risk factors. Additionally, incorporating environmental factors into epidemiological research is essential for understanding their impact on medical impairment in individuals with bipolar disorder and schizophrenia. By identifying these influences, we can refine prevention strategies and improve treatment approach. Thank you.
السيشن بقى بتاعتنا النهارده، لا عملت اوبسيشن قبل كده بس النهارده قعدت مع زينب انت كتير في الفتره الاخرانيه، فانا مقدره كم الضغط اللي كان واقع عليك. انا كنت بحاول ارفع ايدي يعني ماشي، بس واضح ان يعني دكتور ايهاب رغم تاثيره الشديد في الفتره الاخيره الا ان زينب تاثيرها اعلى. لازم تقول الكلام ده. الارقام دي مش بتاعتي، هي بشال نص السلايدز، انا على علم بهذه القصه. فتسلم ايديك، البرزنتيشن كويسه رغم انها كان فيها سلايدز كتيره تفوت يعني الناس اللي قاعدين ما جاوبش ده، بس اوريدي هي رساله فيها كميه اكبر من كده.